equally as wonderful guest. But before I go on, things have changed a little bit in the radio station. So what I'm going to do is introduce what has changed in the radio station before we talk about our wonderful topic that we're going to be having this week on the Body, Health and Mind Show. Now, my name is Dr. Shabina Asad-Kiyum. For those of you who've never seen or heard of me before, I am a GP who works at Central Medical Centre in the heart of Peterborough. It's a wonderful practice. We have a tremendous number of patients. We've got thousands and thousands of patients, and I absolutely love the job that I do, which is that of a GP. And over the last couple of months, COVID-19 has been very tricky, but we will talk about all of that later on. But in the meantime, if you want to get involved, we are on Facebook Live, so you can ask questions underneath the live video. You can also call us on 017 practice. We have a tremendous number of patients. And you can tweet us thousands and on thousands the Twitter handle of Salam Radio. Absolutely love the job that I do. And your tweets will come up. I'll be able to answer some of your questions. Over the last couple of months, COVID-19 has been very tricky. But we will talk about all of that later on. But in the meantime, if you want to get involved, we are on Facebook Live. So you can ask questions at salamradio.co.uk. But like I said, it's absolutely fantastic to have you all back. So before I go on, because I know I'm going to be going on and on, I'd like to welcome to our studio, and I always give a shout out to our station managers because they're the people working behind the scenes, keeping the show going. And I've just had the opportunity to meet with our wonderful station manager, who's called Harry Lowe. And he has actually got a background of recording, and he runs a company called Last Stand Studio, which does music voiceovers. For all your music voiceover needs, go to Harry Lowe. And if you'd like to advertise on Salam Radio as well, get in touch with him. The number to ring or to email is info@salamradio.co.uk. So it's absolutely wonderful to have you. And before I further ado, I'm going to be introducing my wonderful guest on my debut show today. And it is none other than Peterborough's very own Dr. Ruqayyah Zafar. Now, Dr. Ruqayyah Zafar is a GP. She actually is a colleague of mine. I have the privilege of working with her at Central Medical Centre. She's Peterborough born and bred. She completed her medical degree at the University of Leicester. She went on to work in various specialities in Leicester and Kettering before commencing her GP training in Peterborough. Since qualifying, Ruqayyah has really enjoyed the breadth of experience that general practice has to offer. But she feels that the ever-increasing burden of chronic disease and poor patient outcomes requires a new approach. And oh my goodness, when we have our coffee times, we really do talk to Ruqayyah about these approaches that she has, and it's wonderful. It really is. So what this in turn did, it led to her interest in functional medicine and nutrition as a systems and root cause based model of chronic disease epidemic to improve patient outcomes and to create healthier communities. She's completed the Institute of Functional Medicine's world-renowned AF-MCP course and followed this up with further training in cardiometabolic and hormonal health. She's also trained in the emerging fields of nutrigenetics and epigenetics, and she is continuing further studies in nutrition at the College of Naturopathic Medicine in London. But she continues her wonderful work as an NHS GP. She runs her private clinic in functional medicine as well, and she also has a wonderful group on Facebook known as Healing Hormones, which seeks to help women with hormonal problems. But I'm going to keep on going on because even if I speak about her all night, I will never run out of very good things to say. So I'm going to welcome her on board, and I'm going to bid Dr. Ruqayyah Zafar, Assalamu alaikum. Dr. Ruqayyah Zafar, can you hear me? Do we have Dr. Ruqayyah Zafar on board? Let me see what I can do. So, I'm not sure I can hear you through my headphones. So I'm going to ask for a little bit of assistance. Hello? Hello? So we're just going to check that out. But in the meantime, I'll give you a little bit of an overview of the show that we're going to be doing. So in today's show, we were going to be talking about the relevant comorbidities in the midst of COVID-19, obviously in the BAME population. And it's been quite concerning, actually, with regards to how we have been able to sort of look at these outcomes and how BAME individuals or populations are disproportionately affected. I'm going to try one more time with Dr. Ruqayyah to see if we can bring her on air at this moment in time.
Hello?
Hello? Hello? Hello? Hello? Let's see. Hello? I heard Dr. Ruqayyah at that time. Hello? Let's turn the hold up button. Hello? 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 Dr. Ruqayyah, why can't I hear you? Hello? It's like you want to come through. I can hear you there.
Bina?
Hello, can you hear me now? Hello?
Hello?
Oh, yes, I can hear you. Oh, my goodness. Please don't go away. Ruqayyah, can you hear me?
Hello?
Hello, can you hear me? Dr. Ruqayyah, can you hear me? Hello? 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 Right, so we're going to have our station managers trying to get her on air. So hopefully, as soon as we can get Dr. Ruqayyah through, that would be wonderful. But in the meantime, it would be brilliant if you could tell me a little bit about what's been going on with regards to your own experiences around COVID-19 and how you've coped with it all. Now, it has been very concerning. We've seen a disproportionate amount of BAME individuals that have been affected by COVID-19. We've very sadly seen a loss of life here within Peterborough of a lot of people that have ended up in hospital. Indeed, we've seen a lot of people that have been near and dear to us that have been admitted in ITU, and it has been concerning. And in lieu of that, a lot of people have, raised concerns about where this is coming from. An inquiry was set up by the government on the disproportionate effect on BAME individuals as well. So it's been extremely concerning as to why this happens. And one of the things that I wanted to speak to Dr. Ruqayyah Zafar about was the fact that I think we've got a ring coming through. Hello?
Hello?
Hello, Dr. Zafar, can you hear me?
Hello?
Hello? Hello,
Can you hear me?
Yes, I can hear you. Can you hear us? Can you hear us? Dr. Zafar, can you hear us? Can you hear us? Dr. Zafar? Are you able to hear us? Trying to get through to Dr. Zafar to see if... Can you hear... Hello? Oh dear, hello? 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 What I'm going to try and do is see if I can... Hello? Oh dear. I wonder what's happening. So what?
Hi, Shabina.
Can you hear me? Can you hear me? Can you hear me? Dr. Zafar, are you able to hear me? Are you able to hear me?
I can hear you now.
Can you hear me now? Can you hear me now? Hello? Hello? Dr. Zafar, are you able to hear me now? I'm sure we'd work about...
Yes.
Can you hear me?
Hello?
Can you hear me now? Hello? I think the sound isn't very good. Hello? Hello?
Hello?
Can you hear me?
Hi?
Hi, can you hear me? Hello? 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 I think we seem to have lost Dr. Zafar. The only alternative I have is if I can go on speakerphone. So what I'll do is I will speak to Dr. Zafar on speakerphone, and hopefully we will be able to get a noise. But I do apologise for this. This was not expected. So I'm going to get Dr. Zafar on speakerphone. I'll end her call.
Hello?
Hello, Assalamu alaikum, Dr. Zafar.
Walaikum assalam.
It's me, Shabina. We're doing this in a really different way.
Right, okay. No, I heard most of that wonderful and completely undeserved instruction you gave me, and then it cut off. I could hear you sometimes.
But I'm glad that we've got you on. I know it's not the conventional way of having an interview, but I've literally put my mobile phone up against the speaker so that we can have you on. And
Okay.
it's been wonderful to have you. How has your day been? Because I did not have the pleasure of working with such an esteemed colleague today at work.
My day today was quite nice and relaxed for once.
Good.
Doesn't happen often.
Good. And I know
Yeah, it was nice.
I know that you've been giving sort of exams, and you've been really busy, haven't you?
Yes, for the nutrition course, yeah. So my first year for that has just ended
Okay.
last week. So for the next 2 months at least, I don't have to worry about that. And then my final year starts next year.
Okay, and that's wonderful, isn't it? So before we go on to our main topic, Ruqayya, I'd really like to understand, and by the way, I've seen so many metabolic problems that I'd really like to discuss with you when you're next back in our work. But what was it that actually made you go into this field and adopt this it's not a very different approach, it's a needed approach. I've seen that through our own experience with working with patients. But what actually developed your interest in this?
Okay, I guess that's a bit of a long story, and it wasn't one event or anything of that sort. It was, I think, years of just certain questions that kept coming up, and then trying to find the answers in different places, until eventually I got to something that really made sense, and it felt like it sat well with me, both from the viewpoint of my philosophy around health, but also even spiritually.
Yeah.
I just felt like it was aligned to me. And I guess what I'm talking about is when I've always been someone who, I think intuitively, I knew that I wanted a way of practicing medicine that went beyond handing out prescriptions. I really wanted, this is why I became a GP. I wanted to treat the whole person. I wanted to treat holistically. And, I went into medicine with this idea of helping people, and, they would come in and I'd treat them and they'd go away all recovered back to optimal health. But actually, what's happening now is we're not getting people back to optimal health. What's happening is they're coming in with a certain condition, and, to the best of our knowledge and our ability, we're giving them what we feel is the best treatment. Usually, it's a whole range of drug options, and then for some conditions, when the pharmacological options or drug options run out, we go on to surgery or something more drastic.
Yeah.
But the problem I was finding in that approach was it left a whole load of unanswered questions, but also in terms of the patient and how they felt, I didn't see patients returning to a state of health.
Yeah.
Let me give you an example. Someone comes in and they feel okay, but they have high blood pressure. We take that blood pressure over 40 health check. We notice that they have high blood pressure and they have high cholesterol. The patient isn't feeling ill at that point, but we start them on a medication for their blood pressure and a medication for their cholesterol. Their cholesterol comes down, their blood pressure comes down. We feel really great. because the numbers are improving, the patient probably doesn't feel so good anymore because they're getting side effects from the antihypertensive medication and the statin for their cholesterol issues. And then often, you give one medication for one medical problem, you create another problem. You then have to give them another medication for that problem that drug has created.
Yeah.
And I just thought this is not the way I want to practice medicine. But also, I think what we weren't doing was we weren't asking why. Let me give you an example. If someone comes in with eczema, we don't ask. We look at the fact that they've got an inflamed, dry, rough patches on their skin, and we name that eczema, right?
Yeah.
But I think for me, more important than the diagnosis or the name we give that condition, more important than that, the question is why. Why has the patient's skin done this? Why has it done it at this time? Why this patient and not another patient? And that why is very different from patient to patient.
Yeah.
So with eczema, there's a whole load of different causes of eczema that I'm learning now from my training in nutrition and functional medicine. But in conventional practice, normally anybody who comes in with eczema gets a sort of a similar kind of treatment.
Yeah.
We recommend that you keep your environment free of dust. We recommend, if you know particular allergens, stay away from them. We recommend emollients, and we recommend steroid creams when things are really inflamed.
Yeah.
And that's about it. And I just felt like that wasn't good enough. We weren't asking why. We weren't connecting between different diseases. So, if someone has eczema, but they also have diabetes, and they also have a hormonal health problem, and they also have depression, I want to know what's connecting all of these. And this is the thing about functional medicine that drew me to it. It looks at what we call upstream causes. So there's something that if in a river all your fish are dying, you're going to ask what's happening further upstream that's causing all these fish to die down here.
Yeah.
And that's the same way that we look at people. When they come in with a whole load of diseases, in functional medicine we say, okay, well, what's happening somewhere in the body that's connecting all these diseases?
Yeah.
And if you fix that problem, that imbalance that's causing all these diseases, then you fix all of these diseases at the same time. You don't have to give a different drug for each one. So I think that's what got me into functional medicine.
Yeah.
And nutrition, again, I think it was intuitive. I knew that food had to play a large part in healing. So I started studying nutrition, and I think I'm finding that, a lot of things that I thought, a lot of things that we find very difficult to manage as GPs, there's actually alternatives that work. And those alternatives are simple. They're available to everybody. And if you summarize in one word, it's called food. So that's how I got into sort of looking at health from a different perspective.
Okay. Well, I think that's a really intelligent approach. And it's one that, yes, you embark upon a pathway of learning, and you certainly do come about talking about various approaches to comorbidities or chronic disease and illness. And I really like the analogy of thinking of the fish that where are they becoming sick from, and looking upstream. I think that's a really great analogy to make people understand. And we've got quite a lot of comments that have come on board. So we have a Siddiqui, great initiative made by Salam Radio and your support. We have Councillor Mohammed Jamil. Good to see you back on the show, Doc. Thank you. It's good to have you all back. And we have Amber Naqvi. So happy to see you. So there's lots of people who are very happy to see us. We have Munir Ahmed. Welcome back. And Councillor Amjad Iqbal. Good to see you back live and kicking, which is great. I won't take that literally, actually. But thank you so much for all of that wonderful support. And it's absolutely great to be back. Yes, we have technical glitches, but we know how to cope with those glitches, as we have been trying to cope over the COVID-19 pandemic, and how it has changed, I think, the way the world now operates, isn't it, Ruqayya? Especially with how we see patients as well.
Oh, yes. It's made, it's made the world completely different, isn't it? We're not seeing patients very much unless we really, really need to. We're dealing with a lot of things over the phone, and actually a lot of the time it works.
Yeah.
But I can understand for some patients it can be a bit frustrating, but you're right, things have completely changed, and we have to adapt and manage the best we can.
Yeah, it's so important that obviously patients are addressed and they're seen to. I think general practice alongside the hospital has been operating non-stop. We've never cessated services. There's never been a cessation of services. And actually, you might think a lot of people say to us that GPs aren't seeing patients anymore, but we very well are, because we now have new ways of seeing patients. So a lot of housebound patients will now have the ability to see their GP on a webcam, which we never had before. And it's all starting to happen now, which is great in a way. But obviously, I think that you would as well like to reassure patients that we see that it's not that we have just abandoned anybody when we see them on a webcam. We do know when examination is needed, and we indeed do call them in, don't we?
Yeah, exactly. I mean, I've had a few people actually, not only patients, but family and friends who've said, "Oh, I can't get in to see my GP. Or I can't speak to my GP. The practice is closed." And I think that one thing I would like to say here and make sure that everybody's aware is all practices are open. It's just that you can't just walk in and see your doctor. You need to speak to a doctor first, and most things can be dealt with on the phone or via a video link. But in the situation where someone really does need to be examined, then we do bring them in, and I do bring patients in. Every day there'll be a few patients that come in to see us at the practice. You know, if someone has, say, some abdominal issues that you feel you need to examine the abdomen for, you bring them in.
Yes.
We're practicing in a safe way. We are providing the service, and people should be aware that they should seek help when they need it. Contact your GP when you need to.
Yeah, absolutely. And I would second that. Absolutely. Now, it's so funny because we've been having these technical issues, and whilst we fix those technical issues and I introduced you again, we are coming up to a break. Yes, actually. And we are coming up to a break, but we've got plenty of time to talk about COVID-19, which was the actual topic, and I think that it's worked out very nicely. And for those of you that have just joined, obviously, we had that little technical glitch in the beginning. It would be wonderful if you could call us on 017. Well, actually, if we can hear you calling us on 01733 602 133, or alternatively, you can text us on 07411 191062, which is the new number. Do text us. We will see your texts. And you can tweet us. Please follow the Salam Radio page on Twitter, not just on Facebook. It would be great if you could join the Twitter handle or take us on board on your tour, follow us on Twitter, as they call it, and tweet us on at Salam Radio 1062, and we'll be able to have a look at what it is you would like to say to us. And before we actually go, I'm going to introduce Ruqayyah again. I'm obviously very privileged to be working with Ruqayyah in the capacity of a GP colleague, but she's been a GP for the last 6 years, and she's Peterborough born and bred, completed a medical degree from the University of Leicester, and she has had a specialist interest in functional medicine and nutrition as a system and root cause based model chronic disease epidemic and improve patient outcomes. And she's actually completed the Institute of Functional Medicine's world-renowned AFMCP course. So it's an absolute privilege to have her on board. And in the last 30 seconds, Ruqayyah, I am going to keep you on hold so we don't lose you again. And then hopefully when we come back, we will be talking about how COVID-19 has affected ethnic minority communities and how possibly we could look forward to having a look at preventative measures as well. So don't go away, and we will be back. Assalamu alaikum.
Stay tuned to Salam Radio after this short ad break.
Desi Restaurant is open, so why not order now for your family meal tonight? We've got fish pakora, chicken pakora, charga steamed chicken, lamb and vegetable samosas, biryani, pizza, faluda, jalebi, gulab jamun, samosa chaat, fresh chicken and lamb handi, Lahori channa and much more. We've got it all at Desi Restaurant. Special offer, Nihari Opaya with 1 naan or roti only £6. Special lunchtime offer from noon to 4 p.m. Chicken or lamb curry and 2 roti only £6. Mixed veg curry or tarka dal and 2 roti only £5. Order now at desirestaurantonline.com and pay online safely, or call us on 01733 555 795. Delivery available, or you can collect for a 10% discount. 298 Lincoln Road, Peterborough, PE1 2ND. Desi Restaurant, the trusted family favourite in Peterborough.
It's Qurbani time again. Who will you trust to fulfill this noble obligation? Each year, UKIM delivers the freshest and finest locally sourced meat to the most disadvantaged orphans, widows and families enjoying Qurbani. Last year, UKIM delivered your Qurbani to over 500,000 living in poverty for as little as £25, and to make this year's Qurbani the best yet, call 0207 387 2157 or visit ukim.org.
Where can you get high quality and low prices? Amar Food Store and Halal Meat in Lincoln Road, Triangle is the place to go. Pay us a visit and take advantage of our special offers and great range of products on groceries, vegetables, fruits and halal meat. Also send money to Pakistan absolutely free. We have all top brands at special offers, offer free customer parking and provide a free local delivery service. Amar Food Store and Halal Meat, 613B Lincoln Road, Peterborough. Call us on 01733 687 374. High in quality, low in prices.
Peterborough has a fresh new restaurant. Big Mouth on Lincoln Road is now open. Fantastic fresh food, pizzas, gourmet burgers, fried chicken, grilled chicken, wraps and sides. Mouth-watering food at great prices. Come and experience the freshness and taste of our amazing food. On a lunch break, try our Big Mouth lunch special menu from 12 to 4. Fancy our Hot Mouth Big Burger or our Big Mouth special pizza? Try us and taste the difference. Eat in, take away or order online at getbigmouth.co.uk for delivery with Just Eat and Deliveroo. We cater for birthday parties, family bookings and events. Follow Big Mouth Lads on Facebook and Instagram. Big Mouth, 349 Lincoln Road, Peterborough, PE1 2PF. Call 01733 20 10 20. We're open 12 till late every day.
الله لا إله إلا هو الحي القيوم لا تأخذه سنة ولا نوم له ما في السماوات وما في الأرض من ذا الذي يشفع عنده إلا بإذنه يعلم ما بين أيديهم وما خلفهم ولا يحيطون بشيء من علمه إلا بما شاء وسع كرسيه السماوات
It's now 7:13.
ولا يؤوده
This is your very own Dr. Shabina Asad Kiyum back again on the airwaves on the Body Health and Mind Show, Salam Radio 106.2 FM. Oh, I thought I'd lost my flair there. I've been able to sort of put the frequency of the voice in about it. I'm back on the airwaves on Salam Radio 106.2 FM, but I can't be any other way. It's lovely that I can feel that I can be myself, because I always say it's my me time. So yes, ladies and gentlemen and listeners all over Peterborough and beyond, and on Facebook Live and on the airwaves, if you're listening to us nationally, internationally, which I know that you do, please join in. Please ask some questions. I've had some questions that have just come in on my personal mobile as well, which I will be asking Dr. Ruqayyah, who is our wonderful guest today on my debut show. And it was really important to me that I had somebody local who is from, and she's very well accomplished, and she has an accolade of qualifications to her name, and many people say she is the best GP in Peterborough, which I wholeheartedly agree with because I have the privilege of working with her. So it's a privilege to have you on the show. Honestly, it is, Dr. Ruqayyah. So let's talk about COVID-19. It's been a struggling couple of months for very many people. We've had nearly 60,000 deaths, loss of lives from this terrible, terrible virus that has literally come out of the blue. And we have seen the repercussions that it's had of people the world over, and especially here in the United Kingdom. Shu, would you like to give a little bit of a synopsis on the symptoms and signs before we go and talk a little bit about its effect on BAME populations?
Sure. So with COVID, the most basic symptoms or most common symptoms would be fever, cough, muscle aches, fatigue. Those are the ones that people most commonly experience, and it can be any combination of those. But also with it, a lot of people are also experiencing a loss of a sense of taste and smell. And some people will get symptoms that are more sort of located to their gut, so nausea, vomiting, and diarrhea.
Okay.
There's a lot of people who don't get any symptoms at all yet test positive for it, which is obviously concerning, because the worry is that those people are asymptomatic yet they are passing on the infection to other people. Which is one of the reasons we've had the lockdown. So I guess that's the main issue with COVID as a disease, that we're not sure whether it's just people who are symptomatic that are passing it on, or whether asymptomatic people are passing it on.
Absolutely. And we need more evidence around that, and more research is obviously needed with this very new virus that we actually don't know very little about. And there was a question regarding immunity. Now, I've had so many patients actually ask me, are we immune once we have the virus? And initially it was suggested that yes, we do become immune because of the development of antibodies, but we don't know how long that immunity lasts for.
Yeah, I mean, the latest thing I read on it is that they think now immunity lasts around 3 months.
Okay.
And after that, antibody levels fall. Then you are in a position where you can get the infection again. That doesn't answer all our questions, because the antibody response to an infection is only one part of the immune system. There are other parts of the immune system, and it may well be that having had the infection once, the next time you're exposed to it, your body is quicker at recognizing it and therefore dealing with it. But we just don't know that yet. As you say, the infection is only 8 months old. And we need so much more research. But I think where we're sort of settling on at the moment is that this is not something that's going away. It's something that's most likely to be seasonal. At least that's what research at the moment is saying. And obviously, in terms of a vaccine, we don't have one yet. Which is why I think the whole discussion around chronic disease and COVID is so important, because personally, looking at the fact that we don't know how immunity works with COVID, we don't know whether people do become immune for how long, we don't think they become immune for very long. We need to start looking at a different approach. And for me, as someone interested in chronic disease, for me the approach would be, we know that the majority of people who get COVID will recover from it completely, and they won't be hospitalized, and it won't have any long-term impact on them. But a small percentage of people do become very sick, and then an even smaller percentage do die from it. So for me, the question is, okay, why do those people in particular, why do they do worse? Why are they dying from COVID? Why are some people clearing it and having no problem with it, and other people are, ending up in hospital in ITU, and then some of them are passing away? And I think we're in a position where we can't be in lockdown forever. We don't have a vaccine yet. I think we need to start focusing on those people in particular who are vulnerable, and working the risk factors. And we know what those risk factors are. We know it's cardiovascular disease. We know it's diabetes. We know it's high blood pressure. It's cancer. we know is obesity. And what's interesting about severe asthma and older age. Now, what's interesting about all of these things, all of them except one, is either preventable or reversible. And some of them are both preventable and reversible, for example, diabetes. And I feel that we need to really start focusing on that. We need to start focusing on the fact that we can do something about these risk factors. We can reverse diabetes, we can treat people really well with it, we can reverse obesity, and isn't it time we start focusing on that? Because I think that's a much more practical approach. And if COVID is here to stay long term, then we need a long term approach. Whereas at the moment, our approach is very short term: vaccine, lockdown, and masks.
Yeah.
But that's not something we can sustain for years and years.
Yeah. Absolutely. And I think that it's the sustainability aspect, and it's following on from what you've just said, that I've got a comment here that I'd like to share. We've got Sister Rukhsana Kausar. She runs a very successful Peterborough Women's Association group in Peterborough. And she has said, thank you, Dr. Shabina, for everything you've done for our community. I would just like to say we are now starting to see patients at the hospital. It would be great if the GP surgeries could also do more face-to-face appointments. Some people are just not very good at telephone consultations, especially BAME community, due to language barrier and other issues. Now, and it's a very valid point. Absolutely it is. And I think, Dr. Safra, would you like to speak a little bit about this, and then I could add to it?
Sure. I agree, Rukhsana. There's nothing that replaces a face-to-face consultation with your doctor. And in fact, in life in general, there's nothing that replaces being able to see each other's faces, being able to interact with each other's facial expressions. So I agree that we do need to get services back up and running. We were talking at the practice last week about how we might start reintroducing some of our usual services. And like I say, in a situation that a patient really has to be seen, we are seeing them as GPs. We certainly aren't sending people into hospital when it's something that we can deal with at the practice. What we do need to be careful about, though, is we're in a position where the number of cases in Peterborough are increasing. And like I say, it doesn't look like COVID is leaving anytime soon. So it's a balance, I would say. I don't know whether you wanted to add to that, Shabina, but I think, yeah, we're doing as much as we can as GPs. We're going to start doing more, but it really is a balance.
It is. I completely agree with you. And just on the back of what you've said, obviously endorsing what you've said as well, I'd just like to say to Sister Rukhsana that we now have webcams, and a lot of us are bilingual. There are lots of GPs that are actually bilingual. We also have a service for a lot of our Eastern European and BAME communities with a service known as DA Languages, and it offers even Pahari Zaban and language as well. Yes, I read it on that list and I thought, wow, Pahari Zaban, that's amazing. And you also have Pashto. And if you even have a GP that doesn't know that language, I'm multilingual. I know that you are as well. You're multilingual too, Ruqayya. So we can offer that. And you're absolutely right. No, there is no compensation for a face-to-face. However, what I always stress to my patients, and I know that my colleagues do, is that if you are unwell to the extent that you want to have a face-to-face appointment, we will obviously triage that. But if actually you feel that, no, I think that I would do better with somebody seeing a patient, then say that, and I'm sure that that will be taken on board. We are also, on the back of that, governed by what the Clinical Commissioning Group and a network of GPs known as the LMC also advise. And that's a factor as well. The other factor is actual supply of PPE. So our PPE supplies come from various channels, and PPE supply hasn't been consistent. And it's very important to realise that in GP land our seeing of patient is a bit like a conveyor belt. So we will see patient after patient after patient in the hospital. Yes, it very much does work like that. But with our patients, the one that come to see us, there is always going to be that element of risk, which means that essentially, if we're seeing somebody with an upper respiratory tract illness that we don't know could be COVID-19, we immediately have to see them in PPE, but we also have to change that PPE, become sterile again, and then see the next patient with a new set of PPE. So our supplies of PPE have to be kept optimum in order to facilitate that. And part of those processes are to protect patients, and they are to make sure that we as doctors don't serve as vectors of infection to you, the patients, number one, two, to the staff that we work with, and three, to our household members as well. So there are lots of facets to have a look at, and a lot of shared problems with the hospital too, that get their PPE from different sources to GP land. So I hope that's given a little bit of insight, Sister Ruxan. And thank you very much for your question. Thank you very much for all you're doing in the community as well, because your group has been wonderfully insightful and it has been very supportive towards women too. So thank you very much for that. Now, Ruqayya, when we talk about the high proportion of BAME individuals, I know that a report was brought out and it looked at the disproportionate number of BAME individuals that were affected. And one of the things that came to light was not only the health inequalities, but also the socioeconomic inequalities as well. The fact that a lot of BAME populations live in socially deprived areas, and factors of racial discrimination, which obviously it's probably not for a health show better to go into those in great detail. But they play a part, don't they?
They most certainly do. And when I was reading through this report, I was really glad to see that was brought up, because I think often it isn't. And yes, despite the fact that we're talking here about chronic disease and how that might play a part, I don't want anybody to feel that we're downplaying at all the impact of the socio-economic factors and racism. This report highlighted that people were perhaps sometimes slower from a BAME background to actually seek medical help because of negative experiences from the past. And sometimes when they did seek help, actually they were not taken as seriously as, say, a white person might be. So those definitely play a part. And then in terms of socio-economic factors, I mean, those factors are anything from they tend to be doing jobs where they are facing people more often, they are less likely to have access to the right kind of PPE, they are more likely to be traveling on public transport, they are more likely to be living in, multi-generational households, but also households with a lot of people in a small confined space. So all of these factors play a part, and they don't just play a part from the perspective of, an infectious disease. They also play a part in terms of their likelihood of having diseases like diabetes or cardiovascular disease or high blood pressure. And then it's a double whammy, because those diseases then increase their risk of being more sick if they do contract COVID. So yeah, all of these factors are playing a role here.
Yeah, absolutely. And it's very important that you brought that up, because especially the ability of not really hesitating in gaining help because there is that hindrance due to, say, language barriers, or because of fear that they won't be taken seriously, is something that's quite significant. And we have seen that it has affected BAME groups disproportionately in the way that they have passed away or succumbed to COVID-19. And a lot of people don't realise that actually, because they have not had that ready access to the help that they need, they then have become, in a way, super spreaders of infection, because we tend to live within joint family systems. There's a lot more social interaction. And I think Peterborough has been a good example that our mosques have been absolutely impeccable with implementing social distancing measures and restrictions very early on after the lockdown, which has been, I think, a very welcome move. And now that they're opening for Jummah, etc., it's been great. But it cannot be ignored. I completely agree with you. Now, I have a question that's come through from a sister who is saying, great show, ladies. Thank you very much for bringing this up. I have been affected by COVID-19, and I would like to ask, why is it that young BAME people have been dying from this? For example, there was a midwife in Birmingham.
Good question. Very good question. Now, I can't comment on particular cases like the midwife from Birmingham. But we do know that when we're talking about some of the, what we call comorbidities, so these conditions that coexist with COVID and then increase your risk of having more severe disease or dying from COVID, we know that in BAME communities, they tend to happen at a younger age. So, for example, we're more likely to see diabetes at a younger age in people of South Asian descent than we are in people from a white British background. Particularly type 2 diabetes, we know that people of South Asian descent are 4 times more likely to have it. And actually, at the practice that we work at there, we are right in the heart of the Pakistani community. I'm seeing lots and lots of Pakistani women, particularly in their 40s with diabetes. I'm not seeing quite so many white British women in their 40s with diabetes. And I think those things are playing a part. Obesity obviously plays a part. But beyond those, the studies that have looked at these things, and there aren't many yet because we're still, we're still very new to COVID and understanding it. Research has shown that, these conditions I've just mentioned, the diabetes, the cardiovascular disease, the high blood pressure, cancer, when you take these out of the equation, we're still at increased risk as a BAME community. We're still at increased risk of dying from COVID, and we don't know why. Now, that might have something to do with genetics. It might just go back down to socioeconomic factors. We don't quite know. So that's something that's an area that we still need to do more research on.
Yeah, I completely agree. And it absolutely is. We know already through medical research that conditions like cardiovascular disease and diabetes have genetic links to them. So certainly it would be an eye-opening bit of research to check whether there is any genetic predisposition in this case and in this scenario as well. I have another question from a brother who says that, is it true that in COVID-19 the immune system actually eats up the lungs? Very interesting. I know that I wouldn't say there's an element of truth, but actually, if we were to explain it in a more clarified manner, I think it would give some sense, wouldn't it, to how it affects the lungs?
Sure, I can see where that's coming from. And I perhaps wouldn't use the word eat up, but what does happen in COVID-19 is around 7 to 10 days into the infection, people who have severe disease with it have what we call a cytokine storm. So cytokines are, I guess you could call them proteins that are produced by different cells in the immune system, and they serve an essential role, which is to fight infection. And the way they fight infection is they cause inflammation in the body. Inflammation has a bad rep, but actually we need inflammation. Inflammation is, when you have a cut and it becomes a little bit red and a little bit angry. And it happens because actually that's where all the healing is taking place. The problem is that inflammation is out of control or it's chronic, so it's there for a long time. In COVID, with the cytokine storm, what we're seeing is inflammation that's exaggerated. And then that inflammation does the lung damage. So people are dying from actually that immune response. And again, the question that comes up then is, why is the immune system responding in this way? We know that certain, and from my perspective as someone interested in nutrition, we know that certain deficiencies can make you at higher risk of having what we call the cytokine storm. For example, a zinc deficiency increases your risk of having a cytokine storm. So does a vitamin D deficiency. So that's something that, I'm definitely interested in it now. I know there are studies taking place. In fact, I'm a participant for one of these studies where they are looking at the impact of people's general state of health, their nutritional intakes, etc., and the impact that has on, their chance of developing COVID and then the way that they deal with COVID. So again, we keep saying there's a lot more research is needed, but I'm afraid we're going to keep hearing that for a while because we still don't. We have so many unanswered questions when it comes to COVID. But I think what you're talking about there is the cytokine storm, which is the inflammation produced by the immune system.
Yeah, and it's a very interesting concept with COVID-19. There's been talk about different strains of the virus as well. You've got a serious and a less serious strain, and that's obviously going to be more established the more we study this virus. I've got another question that has come up. We've been told that vitamin D deficiency can put BAME individuals at extra risk of developing COVID-19 complications. Is there any truth to this element?
This is really interesting. I did a video on it a while ago now, and I think since then the evidence is just mounting up.
Yeah.
So again, we don't have a interventional study where people are given a whole load of vitamin D and then we look at what happens to that risk of COVID. Hopefully that will happen at some point in the future. But we do know that in countries where there is generally a vitamin D deficient population, for example, Spain and Italy, they had a much worse experience with COVID. We know that with BAME individuals that might possibly be one of the factors. And I'm very careful to say one of the factors here because I don't want to take away from the comorbidities aspect, the diabetes and the heart disease, but also the social and economic factors and the racism part. But vitamin D, certainly there is evidence that it potentially plays a role. Deficiency plays a role in your risk of having more severe disease. We know that vitamin D is very important against viruses, particularly what we call the innate immune system, and we think with COVID that part of the immune system has a particularly important role to play. From other viruses that have been studied, we know that vitamin D prevents their ability to bind to the cells within the lungs, and so we can sort of extrapolate from that potentially the same thing can happen in COVID. But again, a lot of this evidence that's happening, that we're seeing is association. We don't have any studies that prove the link. But I think in future that's something that's going to be of a lot of interest and something that is going to be researched, and hopefully we will know for sure at some point. But at the moment there is a strong association, and treating vitamin D deficiency is so easy, and taking a vitamin D supplement is so cheap, and for the vast majority of people without associated risk, that I would recommend that most people should be taking it actually.
Absolutely. And I want to label you as the vitamin D queen here because I, in my coffee sessions, have gained so much knowledge from you in terms of vitamin D and what we're supposed to do. Now, what would you, Ruqayyah, suggest to our listeners in terms of taking a vitamin D supplement? There are studies to say that pregnant women should be taking vitamin D anyway. What would you say to them? We've got 2 minutes left of the show, by the way.
2 minutes. Okay. So I'll say this quickly. As I said, most people are going to be able to take vitamin D without any problems at all. Just make sure that you've checked your medications with your doctor and you're not already on it, because some people are. And there's no other reason why you shouldn't be taking it. But for the vast majority of people, 4,000 units in the evening with your dinner is going to be perfectly safe. There are some people who are suggesting 10,000 units every evening, and actually when we look at harm we take in vitamin D supplements, it's usually at doses above 10,000 where we see any kind of harm. 4,000 units is a really safe dose to be taking. So start taking it now. You can get your vitamin D levels checked first if you want. Ideally, according to the NHS, we go for any level above 50, but there's a lot of research that we should be aiming for levels around 75 to 100.
Wow.
So anything less than 75, I would say you should be taking vitamin D. Even if you can't get your vitamin D levels checked at the moment, just take it. If you're from an Asian background, you've got dark skin, you're not spending a lot of time in the sunlight, wearing a hijab like me, just take your vitamin D every evening, 4,000 units with your dinner. The reason I say with dinner is because what we want is we don't want the vitamin D receptors to be occupied by the supplement you've taken and then not utilize the sun.
Wonderful.
When you are exposed to the sun, we want you to be able to be making your own vitamin D, because your own vitamin D is always better than taking it as a supplement.
Oh, wonderful.
But
Won-
at the moment, we need those supplements.
Wonderful. Now, 8 minutes left. Thank you so much for joining us. Shout out to Red Gearing, who made his own video and is this young boy, and Arman as well. Thank you so much,
Stay
Dr.
tuned
Ruqayyah.
to Salam Radio
And
after this
you
short
take
ad
care.
break.
Thank you.
This is the moment.
Bye.
A new start. Now the UK has left the EU.
Time for us to get going.
To seize new opportunities as we transition to our new relationship.
Get moving.
It's an